Hi, my name is Dr. Majid. I'm the surgeon and the director of the Metabolic and Bariatric Center at St. Michael's in Newark, New Jersey. I want to welcome everybody to this talk. Thought of the title very deliberately, yet let's unite in the fight against obesity. Obesity is unfortunately a wild spreading pandemic, and especially at home in North America, is spreading like wildfire, affecting not only adults, elderly, but very importantly our children. And we need to come together, not just healthcare professionals, but as a community to fight against this disease. I'm going to start off with from a patient's perspective, because that's the main reason why we are here, and let the patient do the talking.
I suffered a fall approximately 3 years ago and didn't break anything, but had sprains. I had a sprained ankle, sprained knee, sprained back, had 2 surgeries, and as a result, I now have chronic back pain and hip pain. I have done everything, medically indicated, and now was at the chiropractor, and he thought by losing weight that would alleviate some of the pressure on my back. I didn't really take him seriously at first, but when I went back the second time, he started giving me brochures. I was like, okay, he's really serious about this. He wants me to really think about that. Then I had to kind of really think about the fact that obesity is a disease. That was something, a thought process that I just had never ventured to think about before, that this really is a disease and that I'm a person who is afflicted by this disease and have been afflicted by it since childhood. So that was kind of a wake-up call for me, that I needed to do something.
I think my wake-up call probably was when I realized that my quality of life was declining, and it was going down rapidly. I had diabetes. I had a lot of issues with my breathing, with asthma and joint issues, and life just was not a whole lot of fun to live anymore. So I realized that for me to be able to be there with my kids and to do things with my kids and to just enjoy life, that I was going to have to do something, because I didn't want to keep going the way that I was.
I live on a corner house, and I was sitting outside with my son, who was just learning to walk, and we were sitting on the lawn and just playing, and out of nowhere he jumped up and ran towards the street. And the amount of time it took for me to get up and run after him, he was already in the street. And I realized that I wasn't there to protect him, that I couldn't do it at my weight. So at that moment, I knew that I had to do something so that I could be there for him. He was only 1 year old.
What you're going to learn today is what is obesity, the daily challenges of obesity, the cost of obesity, the management options, and we'll summarize and guide you through what the next steps would be. So what is obesity? It is a disease of excess fat storage with a number of associated diseases known as comorbidities. And I want everybody to pause and let that word disease sink in. We have unfortunately associated obesity with just the superficial aspect, the size of our clothes, the way we look. It goes way beyond that. It is a disease, and if we address it with that attitude, then the whole social stigma of whether you want to talk about obesity with your loved one, whether you want to bring it up with your patient or with your doctor, goes away. Just the way we all do not hesitate to seek help with the disease of the foot or the kidney or the brain, we should not hesitate to seek help for the disease of obesity as well. This disease is of excess fat storage, known as the adipose tissue. And what we have learned is that adipose tissue is just not fat sitting there. It's actually an active tissue in terms of it releases several factors which affect organs in other parts of the body and result in diseases. And the diseases associated with obesity are known as comorbidities. And the purpose of this talk is basically educating and empowering the public. And if you can take anything out from here, would be a few key concepts. One of it is that it's a disease. The second, that it is associated with the other diseases known as comorbidities, and such as high blood pressure, diabetes, high cholesterol, and we'll be touching on this in subsequent slides. It is also multifactorial, so many different factors can cause obesity, hence the rationale for having a multidisciplinary approach to the treatment of obesity. You can't just operate and not work on diet and exercise, or you just can't exercise and not work on the other aspects for us to be able to get the goal, which is sustained weight loss with resolution of comorbidities. It is lifelong, it is progressive, it is potentially life-threatening due to the associated diseases known as comorbidities, and it is costly not just in terms of the healthcare dollars and the number of trips to the doctors that patients have to incur, but it's also the psychosocial cost that the obese person and their family members have to go through. What is morbid obesity? It is considered to be clinically severe, greater than 200% of ideal weight or greater than 100 pounds overweight, BMI, which is body mass index, of greater than 40, and BMI greater than equal to 35 with one or more severe comorbid conditions such as high blood pressure, sleep apnea, diabetes. Now, this guideline was established almost 20 years ago in 1999 and is published by references the bottom of the slide by NIH in 2000. So this is an old guideline. Since then, the epidemic of obesity has spread. Our knowledge about obesity has increased tremendously, enough for us to know that this cutoff needs to be lowered. Unfortunately, the insurance companies are basing their approval, not approval, on this set of guideline, which is, as I said before, almost 20 years old. We are, when I say we, societies like American Society of Metabolic and Bariatric Surgery, people who have made this their career, realize that we need to push to get the BMI cutoff much lower, and right now we are trying to push it to get approval for surgery for BMI greater than 30. We do know that the FDA has approved the gastric band for BMI greater than 30. So that's one step in the right direction, but it needs to be expanded to beyond the gastric band. I want to take a minute here and talk about BMI, body mass index. This is another take-home message that I hope to get across, because whenever you pick up any article about obesity, whether it's a scientific journal, whether it's something published in a local newspaper, whether it's something from insurance, you'll see the word BMI. And BMI basically is a standardized tool to measure obesity. So we can't really go by weight. I'll give you an example. 300 pounds in a 5'1" female is not the same as 300 pounds in a 6'3" male. So there are other factors that we have to throw into the equation, such as the gender, the height, and the BMI is a calculation that puts all these factors into its equation. However, it's not perfect, but it's one of the best tools that we have right now, and most importantly, it's universally accepted. So the BMI of 30 here in Newark, New Jersey is going to mean the same thing as BMI of 30 in Australia. Give the example of the way time is minutes and seconds means the same all across the world. So the acceptable range of the BMI is between 18.5 and 24.9. So you want to be in this range. Anything beyond that is obviously not where you want to be, but we want to classify that in different categories of severity. So 25 to 29.9 is overweight, 30 to 34.9 is obese, 35 to 39.9 is severe obese, morbid obese is 40 to 49.9, and super morbid obese is greater than 50. Now, if you recall, in my previous slide, I said that morbid obesity can be 35, BMI 35 and above with one or more severe comorbid conditions. So this tells you that when we look at the patient, BMI is an important tool, but it's not everything. The comorbidities become important too. So if you're a diabetic with a BMI of 35, the current definition of morbid obesity, you would meet that definition. Supermorbid obese, as I said, is greater than 50. Since what we know about the disease is that it's progressive and lifelong, if anybody is in the overweight category, the BMI 25 to 29.9, and they don't make any change in what they are doing with their lifestyle, today they're only going to go up on the BMI scale, and which is the rationale of trying to intervene sooner, because why wait till the BMI goes up to supermorbid obese? Why wait till you have comorbid conditions since we do understand the disease that is only going to get worse with time.